This is an ultrasound study of a young unmarried 20 years old female, 18 years old female. This is the transverse section of her pelvis. She presented with the history of persistent vomiting for a few days, 3 or 4 days. This is the uterus in transverse section. And this is the ovary. This circle, second small circle, is demarcating the left ovary with tiny follicles. You can see this one. The small tiny cystic areas are developing follicles within the ovary. Now on the right side we see a well demarcated echogenic area. This is an echogenic area which is surrounded by hypoechoic ring, and this is basically a cystic area. Why cystic area? Because it does not change its shape. Number one, when I move the probe 90 degrees or 180 degrees, it retains its shape. Secondly, you can see the posterior wall acoustic enhancement. Now for the given age, this cystic area is representative of basically a clot within an ovarian cyst. This white brand of tissue that you are seeing, echogenic area that you are seeing, is representative of clot formation until unless proven otherwise. And however, we can go on enhancing the differentials. Anyway, to me it appears to be ovarian cyst with bleed within it that has with time to have become a clot within the cyst. Now let's study it. This is the cystic area. This is the cystic area under study, and you can see there are multiple tiny cystic areas within this echogenic area within this cyst. Now the cyst basically is, here is the cyst. There is fluid in its medial margin. Now you will feel the difference. Now this is a scan from a different plan, where the same cystic mass is now appearing, both cystic as well as solid. Now this solid echogenic area within the cyst has multiple tiny cystic areas within it, and if I had Doppler, to me it appears to be a vascular sort of a mass with these tiny cystic structures suggestive of vessels within this cystic mass. And this medial margin, at the medial margin you can see fluid with echogenic areas within it. Now this is a magnified view of the cystic mass, and you can see that it's maintaining its shape. I am giving this here. I have given almost a 90-degree sweep to the probe. There is no calcification seen within it. These tiny cystic areas and these areas are suggestive of vessels within this cystic mass, which measures approximately 4 into 4 centimeters. And well, this is the okay, let's bring it to the normal. Here is the uterus. This area is the uterus. This is cervix. This is the urinary bladder. Transverse section. This is the ovary, the left ovary. And And this is the left ovary. You can see the follicles developing within this cystic, within these cystic areas are representative of developing follicles. And this is the left ovary. This is the uterus. This is the endometrial canal. This is the mass under study. It gives posterior acoustic enhancement. So this can be a dermoid as well. And we cannot rule out the possibility of an aggressive pathology. See the landmarks of this structure. These are the iliac vessels. So this is an ovary, ovarian cyst. Rest all of the ultrasound is unremarkable. So such cysts require further evaluation, keeping in view the age of the patient,